Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. I was treating a young lady from Illinois, one of my wonderful clients that I have here, and she had friends of hers with her, and then Tavia here is from the famous Cable family around Peoria. And then the Cable family I've known just for years. So there's people around Peoria, because for most of my career I practiced in Oak Park, Illinois. And then there's a friend of mine, a really close friend of mine, Kurt Ehling, who's a chiropractor in Morton. And then because of our friendship and his knowing about prolotherapy, there was a lot of folks around Peoria that ended up seeing me in Oak Park and the Cable family. So when you said you were a Cable, then I said, well, are you, is it your dad that I treated? And why don't you just go into like how your family knew about prolotherapy? Well, they got treated like 20 some years ago and they're into hockey. And then tell us your story about prolotherapy.
Yeah, my uncles played hockey, and I personally have gone to Dr. Ehling most of my life. So he basically, when I went to him regarding my knee injury, he had already sent my uncles to you. I believe one of my uncles, it was a shoulder injury, and I think my aunt saw you for migraines actually too, so you did her neck, and they had amazing results. So I came up to you and not really knowing the issue, and I had one-time treatment, and I think I was 12 years old.
Yeah, how old are you now?
I'm 27, and still no issues at all, so yeah.
Yeah, and then you had Osgood-Schlatter.
Yeah.
And then were you in athletics then?
Yeah, I played volleyball, so we didn't know if maybe just diving, the squatting, all those things, so we weren't sure if it was regarding that, but basically when I came to you, figured all those things out, and it was no issue after that. So yeah.
And then you got back to pretty quickly out of the volleyball.
Yeah, it was really quick recovery. I remember probably a couple days. I mean, it was a while ago, but I remember a little swollen, a little tender for a couple days, but then I was back to playing, and it was no problem at all. No knee brace afterwards or anything. And I had actually previously done some physical therapy and worn a knee brace and stuff while I was playing, and after that I didn't have to do any of that. So yeah.
No, thank you, Tavia, for your story, because one of the things we wanted to do with this video is just to show people that actually prolotherapy does have some long-lasting effects. And it's not just you, like your uncles, they were in professional hockey, so
yeah.
And they all did really well with prolotherapy. And did you say your mom or your aunt?
My aunt, yeah, for her migraines.
And she did well with her migraines, like she doesn't have migraines.
Correct, yeah, and my great aunt, she's had it on her sciatic as well, and she's back to playing tennis and golfing and everything, so my family has a lot of good results with Prolo, yeah.
And then you even said to me, I think you said, was it one of your cousins now is in professional hockey, and then even the team sent him to go see a prolotherapist or something?
Yeah, he plays junior hockey, and he had, I believe, hamstring injury, and they sent him to Prolo, and I think he had maybe 3 times, but in a short period of time. Yeah. And he's just 17, and he was back to playing full speed. Actually, they even said that his skating got better afterwards. There was more flexibility there. So yeah, it really was good.
No, I think the athletic teams are more and more just realizing it, because it's interesting, because I'm now in Florida and I haven't actually seen so many professional athletes here. And some of the MMA fighting teams, like America's Top Team, are pretty, within 2 or 3 hours of me, and I haven't seen any of them. And I just think, PRP, and there's more and more doctors, doing it. So it's good. So athletes, instead of getting cortisone shots, they're getting you get a hamstring tear, and they're like, nope, we're going to get PRP or prolotherapy.
Yes,
so it's.
I agree, and I mean, for any sports, you're thinking the longer you sit out, the less chance you have to be playing or starting. Somebody can swoop in and take that position from you. So the quick recovery of Prolo, I think, is huge too.
And then tell us what's going on with you now. You're a new mama, right?
Oh yeah. I've got a 2-year-old little boy at home. He's great. Yeah.
He's doing good.
He is. Yeah. Yep.
Awesome.
Still seeing Dr. Ehling. So,
oh, great.
Yeah.
We'll send out our love to Dr. Ehling
we will.
And his wife, and and your uncles. Tell
Yeah.
them I miss injecting them.
Yeah, I'll let them know. They will say hi back, I'm sure.
Thank you.
Of course.